Now let's turn and talk about cannabis. The Department of Health and Human Services is formally recommending the government ease restrictions on it.
Right now, marijuana remains illegal at the federal level, even though 40 states allow its use in some form. The move comes 11 months after President Joe Biden ordered the top health agency to conduct a review of the substance. NBC News health reporter Aria Bendix joins us now. So, Aria, to be clear, this is not legalization. Instead, this is a reclassification from the government, right? Moving from a Schedule 1 to Schedule 3. But help us understand what exactly that actually means.
Yeah, that's right. So let's break down the difference. And we have a slide to show you with Schedule 1 first. These are drugs that don't have a medical use, and they have a high potential for addiction or abuse. So things like heroin, ecstasy, LSD, and marijuana is currently in that group right now. And what HHS wants is for it to move to Schedule 3. So let's take a look at what that means. Those are drugs that have more of a medical use, less potential for abuse or addiction. So things like ketamine, Tylenol with codeine, testosterone, anabolic steroids, and they can be purchased with a prescription legally. So that's important.
A lot of people are probably looking at this and thinking, yeah, of course, marijuana being labeled the same as heroin, that sounds absurd. What has the response been to HHS's recommendations?
Yeah, it has been positive for the reason that you mentioned, because we're getting these federal classifications closer to where states are at. And what this can do really is open up more research for cannabis. It can help businesses, legitimize businesses that are already selling cannabis legally, potentially open them up to get tax credits or deductions that they weren't getting before. The Cannabis Industry Association obviously thinks this is positive, but they want us to move a little bit further. I have a statement in front of me here. They are saying the only way to fully resolve the myriad of issues stemming from the federal conflict with state law is to remove cannabis from the Controlled Substances Act and regulate the product in a manner similar to alcohol. Obviously, we don't do that right now.
Well, to that end, right, I think people might hear this and go, okay, so is this increasing access to cannabis? Of course, we know there's still some contention in the federal space. So who needs to ultimately move that ahead?
Right. So the Drug Enforcement Agency will decide whether to change this classification. They're taking it under review right now. There will be an opportunity for public comment, and then after that, they will make their verdict. But ultimately, it's up to the states to decide whether the consumer can legally purchase cannabis, and that's already states already have their existing laws, so this won't change anything for the consumer.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.